Hi, welcome to Detours Understanding Acquired Brain Injury. This is Essentials of Pediatric Acquired Brain Injury, Traumatic Brain Injury, Part 1. And so we're going to be talking about specifically traumatic brain injury and some of the basics of what happens with traumatic brain injury in children and adolescents, more about like the mechanisms and so some of the both microscopic and macroscopic effects of traumatic brain injury. Now we've talked about with adults and traumatic brain injury in primary, secondary, tertiary effects of brain injury. We'll be doing the same here, but since we covered a lot of it in the adult section, we'll only be really talking about like some of the differences and just a brief overview with regards to pediatrics and ways in which it's different. And then we'll be going on from there, but we will give at least brief brushstrokes. And so let's get started. First of all, with kids, obviously, it's kind of the same in that their traumatic brain injury in kids, there's mild, moderate, and severe, and we use the Glasgow Coma Scale, same as we do with adults. There are some modifications naturally when it comes to infants or very young children who don't know how to speak yet, and we use this scale for young children and for infants. For the GCS. As far as older kids, school age and beyond, we use the adult scale just because, it's like the same signs and symptoms. And we use the other measurement scales in the same fashion. Very few things are adapted for kids because of, again, that paucity of research and some of those challenges. So when a child, just like an adult, suffers a traumatic brain injury, there is, first of all, the primary injury, and that's what happens immediately, right after they either have a blow to their head or whether they have a sudden deceleration from moving to stationary or go from stationary to moving. That sudden change in acceleration throws the brain around quite a bit, and the different densities cause ripping, twisting, tearing of neurons, and may cause both focal and diffuse brain injury. Again, it's the same thing as with adults. The damage that happens here happens within milliseconds, seconds, minutes, to within an hour or two. This stuff is usually all happens before even EMS or care providers or whatever come on scene. This kind of injury and damage from the trauma. There's really nothing you can do about it. And what's done is done here, and that's why part of why TBI is difficult to treat, because at least for the primary injury, what happens, that happens. So what are the effects of primary injury? Skull fracture. One of the first things that will happen if you hit your head on something or are hit by somebody in the form of an assault or whatever else. In many cases, there's skull fracture. There's also damage to facial and cranial nerves, which come right out of the brain directly and innervate the different areas of the face and into the body. In the case of like trigeminal nerve, the vagus nerve. And so this is part of why brain injury, often you see accompanying other forms of injury, other forms of dysfunction. And we'll get into that later. You also will see as well the localized focal contusions, direct bruises on the brain itself, because the inside of the brain, as you saw before, it has a lot of bony edges, sharp edges, and will literally scrape against the brain itself, as well as the pulling, pushing, twisting, and tearing inside the brain. traumatic axonal injury or diffuse axonal injury. See this in kids, and it's just the same as in adults. It's debatable, there are either 3 or 4 grades of diffuse axonal injury. The other name for it is traumatic axonal injury, since while it's true that's quite often diffuse in lower grades of traumatic brain injury, you may see it more focal. But this kind of injury happens almost immediately, the tearing and the twisting. And in some cases, where the research is suggesting it doesn't completely tear, but it may overstretch neurons, and that over time causes them to deteriorate, to die. There's also things like traumatic arterial dissection. And so the arteries that feed into the brain, the force of whatever it may be, if it's a car accident, a fall, an assault, may also cause the arteries that feed into the brain to tear or to become occluded. And then you have the equivalent of a stroke. Between primary and secondary injuries, you also may have epidural, subdural, parenchymal hemorrhaging, so you get bleeding into the spaces around the brain. And this happens either as primary injury, depending on how long it takes for this to happen. If there is an arterial or venous dissection, this may happen more quickly. So those are the primary causes, and those are the things that do the initial damage before a patient even gets in to the hospital for care and treatment. Secondary injury happens over a few hours to days to weeks, even to months. And things like edema, we've talked about this one before, cytotoxic edema and vascular edema. Cytotoxic has to do with, edema of all sorts is brain swelling. When the brain swells up inside the skull. Infants whose bony plates that form the skull have not yet fused, there may be a little more play, so they may have a little bit more flexibility, may be able to take a little bit more edema, but those plates, once they fuse, then the skull is in effect a closed box, and the skull is hard and inflexible. Cerebrospinal fluid is a fluid, it's non-compressible. Brain tissue, squishy, flexible. Guess which one will give way when there's elevated intracranial pressure? It can lead to something called herniation, which is where tissue either compresses against itself and does damage, or tries to squeeze down openings in the skull. Mainly, for example, foramen ovale, where it'll literally try to squeeze brain tissue down through the spinal column. And considering that the brainstem is there, you may end up herniating areas that control breathing, the reticular activating system, through the brainstem area. Elevated intracranial pressure would end up stopping the heart, stopping breathing, obviously lead to death. So, but there are also areas where brain tissue is against brain tissue, and it may end up herniating against those areas and doing serious damage there too. So elevated ICP is bad for this reason, and it causes damage in these ways. And of the types of edema, there's cytotoxic and vascular. One has to do with transfer of fluid between the cell and the intercellular space. The other is between the blood vessels, blood-brain barrier, and capillaries. And so these both are ways, and you see both within with traumatic brain injury. So, and kids, it's important to keep in mind, kids have problems with regulating blood pressure, and kids have trouble, especially, with traumatic brain injury. Their volume is lower than adults, and they also have problems with controlling their the venules, the capillaries, the arterioles. All of these systems don't work as efficiently as they do in adults, so they're more vulnerable. Hypoxia and anoxia, they're secondary damage also, and so problems with transporting of oxygen and getting waste out due to the head injury and the swelling. There's difficulty in moving oxygens and into the cells and getting O2 and getting lactic acid buildup and cellular waste products out. Bleeding, as we mentioned earlier, depending on when that starts and if there's damage to blood vessels due to swelling, or if something was torn during the initial phases, slow leaks throughout the brain also increase likelihood of this being a source of damage as well, or a clot forms, or get vasoconstriction. Problems again with microvascular regulation. You may get blood vessels that clamp down and don't relax, and this leads to hypoxia, hypoxic ischemia, death to neurons, as well as lack of nutrients getting to neurons, and it's kind of a reflexive reaction. And we see this as secondary source of injury. There's the neurometabolic cascade that we talked about, sudden release of glutamate, calcium from damaged neurons. They lose control of their own neurotransmitters when there's excessive glutamate released as an excitation kind of response, and this stimulates other cells in the area, and neurons that are torn will just dump all their calcium into the cellular intercellular space, and this will trigger others to do the same. And unfortunately, it's calcium poisoning, if you will, within the brain, and this sets off a cascade of this. Plus glutamate doing the same thing. Sudden surge glutamate overstimulates beyond its ability to regulate other neurons, and likewise they will not only overfire, but they also will lose control of their ability to regulate the sodium potassium pumps, which also fail due to a lack of nutrients coming in, of waste going out, and they self-destruct. They're apoptosis, that chain, and so more sources of secondary injury. Also failure of the mitochondria to be able to control the waste because they're still developing, and that leads to further destruction of neurons. MicroRNA, which is the non-coding part of some RNA, which are used for repair and maintenance, these fail. Enzymes are used up that are used to maintain reactions if you have an excessive buildup of, this is where free radicals are a problem, the production of free radicals in an effort to try and control this mess. If there are too many free radicals which have extra oxygen available, and that binds various proteins or binds other enzymes, and this is why too much oxygen can be a bad thing. You need antioxidants which tie these up and affect these free radicals. If you don't have them, the oxygen molecules are destructive. For example, superoxide dismutase, which is one of these, to bind and tie, because oxygen is otherwise devastating, too much of it. So you need this enzyme in order to bind it down. But if you've used it all up, the oxygen is quite destructive in this chemical cascade. Mitochondria fail, and so there's this whole complicated problem at the microscopic level, which is leading to destruction of neuron after neuron after neuron, and they kind of encourage each other too. And so kids, again, as their neurons are still developing, their defensive systems aren't as good within the cells because they're not fully grown yet. They don't have same numbers, they don't have the efficiency, and so they're already behind the eight ball. Um, Brain injury, you see tau protein deposits depending on how frequently, if it's a bunch of repetitive mild brain injury or one bad severe one, you may see a production of these alternative tau proteins. Instead of the very symmetrical 8-sided, you may see production of the 6-sided, more sticky ones. We've discussed that as well. The leukoencephalopathy, this takes long. That's almost a tertiary kind of problem. Damage leading to the ventricles and the system that moves fluids, cerebrospinal fluid in and out. The lymphatic system fails, and over time, towards the tertiary problems, we see atrophy of brain tissue. And for kids, this also can mean that they won't develop the necessary skills over time. They're more likely to grow into their deficits. Unlike adults, where you see these because you already have these expectations to have their skill sets. For kids, they'll show many symptoms that come from the brain injury, but it'll take time to show it. But the secondary cascades, there are experiments in trying to find medications to help treat these, but work is still ongoing, and there have been a lot of false starts, you might say. So hopefully we'll find something to treat this, because this is the only portion of brain injury, traumatic brain injury, we can actually treat. Is a few of these things, like trying to cool the body down, removing a piece of the skull in order to allow for edema, trying to treat those components, making sure they are adequately oxygenated, making sure the blood pressure doesn't fall too low, so medications to keep the blood pressure up, giving them blood, controlling pain, because you don't want to make things worse than they are. Reducing inflammation, because inflammatory factors from the immune system are another problem with secondary effects, secondary injuries, because if the blood-brain barrier breaks down, which is likely in the more severe injuries, then that means that you'll get glial cells or other cells getting into the brain, and wounded cells that might have a chance of making it are destroyed instead by the immune system. And so that is also a secondary factor. And the brain will oftentimes look at neurons, and it may say, hey, maybe we should destroy this one, instead of allowing it time to recover. And more immune factors present, the more likely it is to react in that way. So that is yet another component of secondary brain injury. And so that's, all of these things contribute. And then there's neurostorming, which contributes, which is where any kind of disturbance or whatever triggers a rise in heart rate and sympathetic signs and symptoms, rapid breathing, and even if the patient isn't fully aware, their nervous system will spike a reaction. Kids are more vulnerable to doing this than adults, but and this also puts pressure on the brain and the nervous system, and they're more likely to have generalized inflammatory reactions too. So these are all the secondary, kinds of effects. Now, what about tertiary factors that can affect over a long time the way the brain is injured? These are all things that can make it worse even, and these happen over a much longer period of time. Some kids will develop seizure disorder, and I'm not talking about immediately after the brain injury, but a couple years potentially. And the seizures pose a threat. Some medications that they'll have to take pose a risk to furthering brain injury. If you've had one brain injury, you're more likely to have others because it affects your reflexes, speed at which you react. So you're more likely to suffer another traumatic brain injury. Disruption to your metabolic systems, your endocrine systems. So lower levels of growth hormone, thyroid hormone, all these things can have an effect. Post-traumatic hydrocephalus, briefly touched on that before, and problems with developing academic and social skills, leading to isolation, communications problems, not getting reinforcement, and not getting what you need to develop your neuroplasticity, as well as genetics playing a role in healing. So there are a lot of different things that, affect long term. So let's talk about symptoms over time. There are motor and sensory disorders that a child may develop from their injuries. Things like hemiparesis, which is being paralyzed on half of the body. Problems with ataxia, coordination, balance, swallowing, problems whether it's water, whatever, fluids. They may choke easily, cough, and that kind of thing. Problems with eating, dyspraxia of speech, so they may have trouble saying words. Even if they know the word, they may have trouble coordinating tongue, lips, that kind of thing. They may have sensory impairments, cortical blindness, which is due to damage to the brain that affects their ability to see. Cortical deafness. This is rare, but it does happen because you have to damage both the left and the right temporal lobe in order to prevent you from being able to hear due to neurological damage. It's more complicated than that, but that damage to these areas prevents you from making sense of the sound that's getting in. So your ears are okay or your eyes are okay, but you cannot process what's coming in. There's anosmia, guesia, so you can't smell smells anymore if you damage your olfactory bulbs, which are up back here, and problems with sense of taste. Again, now touch is interesting because its function is distributed across a large area of the motor of the sensory cortex here. So losing that's not common. You might lose certain localized functions, but also neurocognitive deficits. Things like whether it's repetitive, mild, moderate, or severe, these are common also. And again, kids, it's like you may not notice right away, but they develop aphasias, problems with speech, word finding or pronouncing it, or dyslexia problems or alexia, inability to read or difficulty learning to read, acalculia or dyscalculia, problems learning mathematical skills, number sense, developing the ability to count, compute. Again, as dyscalculia, trouble learning to do it and developing those skills, or a weakness in it as opposed to the complete inability to do it, which would be the acalculia. Agraphia, inability to write. Dysgraphia, trouble with it. And there are different types. I'm going to get into that a little later. Of course, about the executive deficits, planning, judgment, abstract thinking about things that are not present immediately in the environment, the ability to manipulate things symbolically, and to represent things in your head. Short-term memory, of course, problems paying attention, may be misdiagnosed as ADD, ADHD, especially if someone has forgotten they've had this brain injury. Problems with cognitive flexibility, only being able to think of things one way, not being able to think of alternative things, black and white thinking, everything has to be this way, absolutism. Kids do this. This is common for kids generally, but they can't. A person with cognitive inflexibility is stuck this way. They have trouble ever changing, and this is common with brain injury. They, unlike their peers, brain injured kids stay like whatever age they were injured in many cases. And so you may not notice until they get older, hey, they're not getting better with their thinking. Behavioral or emotional, irritability, aggression, alexithymia, where they have problems with recognizing their own emotions. Everything is they're angry about it or they're sad, but they really don't have any subtlety and they cannot recognize their own feelings. They have to be taught, again, how to recognize. There are certain techniques that help with this. Oppositional defiant disorder, many of these kids are diagnosed with, but that also may come from cognitive problems that they have too. And it's important to keep that in mind as a long-term symptom. Depression, anxiety, obsessive compulsive disorder, self-centeredness. Again, they seem like a much younger child if they were older and they develop this, whereas if they're like 5 or 6, this is just normal, even though it's a sign that something's wrong. But everything is not necessarily selfishness, although it can be. Self-centeredness, they cannot take the view of the other. And they have trouble thinking about what other people might be thinking. How do you think, Billy might feel about that if you do that or you say that? Tactlessness, seem kind of rude. Again, if they're younger kids, that's normal. Hey, mommy, that lady is fat. Not thinking, hey, she might be upset. And the inability to develop that sense, again, depends on how severe. We all know frontal lobe, either personality change or problems with personality. Some inherent silliness in some cases. Right frontal lobe injury tends to be more kind of joking, but in a strange kind of way, more childishness that persists past when that would be appropriate. Impulsiveness, just acting out any old way. Difficulties with making friends and keeping those friendships. Trouble communicating emotional content or receiving it. Trouble with criticism. Trouble with any kind of social or emotional functioning in those ways. Eventually, the possibility of developing addiction, and as an adult, the development of serious mental illnesses is high. And this is, again, a problem because often in the psych hospitals, this gets missed, that there is a brain injury. So it is important that as a parent, if you know your child has a brain injury, sustained a brain injury, even a few mild ones, to keep note. Mild brain injury does not mean mild symptoms. Mild brain injury does not mean mild symptoms. Drill that into your head, because a lot of these kids can have moderate or severe symptoms or not a great outcome, and it gets mistaken for something else, misdiagnosed or mistreated because it was forgotten. That's referred to as an occult brain injury, a hidden brain injury. That's what occult means, hidden. So keep in mind that a child who's diagnosed, nobody in the family ever had, mental illness. Maybe it's because your kid has a brain injury or had one. Traumatic, had a fever, had like a really serious one for a while. It was maybe they weren't able to breathe during that asthma attack for 5, 6, 7 minutes. Just as a reminder. Here's something else. Children and adults, generally, but people with traumatic brain injuries make up 85% of, for example, of those incarcerated for violent crimes. So specifically, women who are incarcerated for violent crimes have traumatic brain injury history, and more than 60% of men incarcerated for violent crimes have a documented history of traumatic brain injury. And who knows the undocumented ones? They may have occult brain injury. More subtle executive and social disabilities and mild traumatic brain injury. may be just as disabling. Mild TBI, remember, mild TBI does not mean a mild outcome. They may be just as disabling, but harder to pin down. So parents may know something's wrong, but trouble pinning it down because they look good, they look fine, but there's something not right. And so these really subtle deficits, and so everyone's expectations is they're back to normal, but they're having some problems, or they may know they're having some problems. They can't exactly remember. Your brain controls everything, including your personality, your behaviors, your thoughts, everything. Damage here, damage to your processor affects your output. All right, and that is for episode 1 of the Traumatic Brain Injury series. We will be getting a little deeper as we go from here on pediatric traumatic brain injury and then generally acquired brain injury as we go from here. Hope you found it useful. Please like, subscribe, share, and we will talk to you later. Don't forget to like and subscribe, hit that bell icon, and share. And also, Friends with Brain Injury. Visit our website and visit our Facebook page and visit and talk, and also check out our support groups. We have one on Monday evening at 7, and we have one on Saturday at 1 Eastern.